ಏನ್ರಿ ಶಂಕರ್ ಫುಲ್ ಕಾಣ್ತೀರ ಇವಾಗ ಕ್ಲೀನ್ ಆಗಿ? ಆಗ್ಲೇ ಕತ್ಲೆ ಇತ್ತು, ಮ್ಯೂಟ್ ಆಗಿದೆ.
ಕ್ಯಾಮ್ರಾ ಸೆಟ್ ಮಾಡ್ತಾ ಇದ್ದೆ ಸರ್.
ಓಕೆ ಓಕೆ, ಇದು ಆಫೀಸ್ ಅದು ಮಾಮೂಲಿ ಹಳೆ ಡಿಸಿ ಆಫೀಸ್?
ಇಲ್ಲ ಸರ್, ತಾವು ಬಂದಿದ್ರಲ್ಲ ಸರ್ ಅವಾಗಿತ್ತಲ್ಲ, ಅದೇನೇನೆ ಜಿಲ್ಲಾ ಪಂಚಾಯತ್ ಅದೇನೆ ಸರ್. ಚೆನ್ನಾಗಿದ್ದೀರಾ ಸರ್?
ಫೈನ್ ಫೈನ್,
ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಓಕೆ.
ಮಾನಸಿಕವಾಗಿ Very good morning to all of you. I think we have waited for a few minutes and we can start the meeting. Yeah, Anjani, you can go ahead and initiate the meeting. Yeah.
Okay, sir. Good morning, everyone. Thank you for joining us for today's webinar. This is Anjani, Project Engineer, Karnataka State Council for Science and Technology, welcoming you all for the Azadi Ka Amrit Mahotsav Vigyan Utsav with the theme Science and Technology. As you may aware that India has started the celebrating the 75th years of independence on 15th August 2021, and Honorable Prime Minister has desired to infuse new energy and new consciousness among the countrymen by showcasing and celebrating the achievement of last 75 years through Azadi Ka Amrit Mahotsav. So, Karnataka State Council for Science and Technology is organizing a webinar to address the theme Science and Society. I would like to welcome our Executive Secretary, Mr. H. Hemant Kumar, to brief about the theme. Over to you, sir. Sir, you're muted, sir. You're not audible. Hemant, sir.
System mute ಆಗಿದೆ.
Sir, you're muted, sir.
Yeah, I'm sorry. Yeah. Now it's audible? Yeah.
Yes, sir.
Yes.
Okay. I'm sorry for that. Very good morning and very good morning to all our participants and also the experts who joined us today. Let's introduce the today's webinar and why we are doing this webinar series since last year, September 2021. So, as you know that India celebrated its 75th year and the Prime Minister vision is to see that the S&T institutions across India get together and do something to do for the benefit of science to the society. So in that context, I think somewhere in August, all the councils we met and discussed and deliberated on many issues, and we decided to address one theme each month. We have 12 themes starting from September. The first month we started with, it's like this. Each month there will be a theme and all the 30 councils that we have in India will, and each day, one of the days, they conduct these webinars at their, within their state, and it's also being live through YouTube by the SSTP portal of DST Government of India. So we started with science, technology, innovation institutions at the state level. That was our first thing, and it was addressed well. And we are also bringing out a white paper on all these themes once we complete all the themes by the end of August. The second one was human resource development. Then we looked at the R&D infrastructure available at each of these institutions and how we can actually leverage the centralized R&D infrastructure facilities for the people who do not have such facilities. So I think the objective from DST Government of India, all the state council is that why not we have a centralized R&D infrastructure facility so that all the technology scientists, students can use it. Then we looked at indigenous technologies There are many indigenous technologies in India which, because of the requirement or the aspirations or the change in the situation, they must have not relevant today. So we have to look at technologies which require science and technology inputs to take it further. So we discussed that during that indigenous technologies. And then we talked about innovation and startups. That was one thing. I think Karnataka is well equipped to head this particular theme. We got quite a good response there. And then the next we went to science, communication, and population, because all along is also one of the difficult subjects for us. How do you communicate science and popularize it among the public? Because we should be able to tell them convincingly and also the benefits of it, so that public feel the presence of science and scientific institutions is relevant to this country. Otherwise, if they don't see the direct benefits to them, they feel left out. So that's one of the theme that we looked into. Then the women in science and technology and science and technology for women. So we invited the best scientists in Karnataka, and they talked about the relevance of science and technologies women's life, and what can women do for science technology as well. And today's theme, as you know, that it's science and society, and a few more themes we have in the coming months. That is about future technology, basic science for Atmanirbharta, then Atmanirbharta and industry, and finally we end up by intellectual property rights. That's going to be in August 2022. So before getting into this webinar, I would just like to mention some of the things that we do at the council. Our council, Karnataka State Council for Science and Technology, established way back in 1975, probably one of the first three councils we established in the country. And one of the biggest advantages is that we get funding from both the state and central government, including core grant and also for the project support. And our strength is research, development, dissemination, and from the last 3 decades, we are looking at how do you convert the R&D outputs to technologies which can make a difference to the life of the people through product services or prototype development. So this is our top of the interest. I mean, that's what we do. And we also do a lot of support the government in terms of using technologies. One of them could be GIS and remote sensing, or rainwater harvesting, or could be education, or in bioenergy, so on and so forth. And fortunately, this council, since being established by Indian Institute of Science, has the provision of getting mentorship from IIC faculty as well. For example, I think right now we are processing the faculty projects received from close to 160 plus colleges across Karnataka. They are likely to, some of them are likely to be funded, and for which we are grateful to the IIC faculty to getting involved in this and also agreeing to mentor some of these projects as well. And we work with all other institutions, including academic, NGOs, industry, all that. Basically now, currently our goal is to see that from our council, we have more and more of technologies which could end up as a startup. Startup, not necessarily it could be a private startup, it could be a public startup or a Section 8 company within the ambit of the council itself. So these are some of the things that which we plan to do. And just to give you briefly an idea about what we do in the council and which are the major programs, we have one of them is use of GIS and remote sensing for supporting governance. So this is one of the biggest achievement for the past 3 decades. These centers are supporting the district planning department through data information and services. And recently, planning secretary, additional chief secretary, has made KSCST as one of the nodal agency for monetizing the data. See, so far our data has not been exposed to public in the sense, even though some of them are exposed, some of them cannot be directly consumed by third-party softwares. So what we are trying to do now is systematically convert all the data that we have into the standard format so that it could be integrated it could be forward integrated for developing applications through a PPP model. That means to say that the government now is willing to work with the industry, and one of the example is working with Map My India. So this we would like to use all our resources, not just the data. It could be our assets and resources as well. This will be used in coming months or years, and we're going to have a good number of MOUs so that we have a fair competition among the private vendors as well. A few of them just want to list out. One is, I think all of you know that rainwater harvesting is there from almost 2 decades now, and we've been supporting the departments and the public, private, and individual property holders, including apartments also. So recently, my colleague conducted a international water day, in that we received quite a number of representatives from apartment owners associations, and I think this was very well appreciated by them. Not as if, see, for them water is a crucial thing because it's cost them money. So unless you have a technology which provides some benefits to them, let's look at it this way. I think technology has to be made use by people, then only they can appreciate it. So on and so forth, that we work with watershed and drinking water, water body restoration, and so on and so forth. And apart from that, we have the education program. As I just mentioned, we have the faculty program where we support the faculty in bringing out prototype products and services. Hopefully, we end up funding about 20 projects this year. And one of the interesting things that we are doing is trying to put up e-learning centers across social welfare department schools. So this, in a way, that put the school children on par with the private schools across Karnataka. That means to say that the quality of education in the e-learning centers will be pretty good, because they're going to have the benefits of all the 3D experiments and also the centralized syllabus from DSCRT. And you have a good quality of teachers also, possibility of teachers also coming in and explaining some of the hypotheses during the e-learning centers. So this one thing which, incidentally, they started much before the COVID. So COVID actually hastened the process. Probably COVID everybody wants to do in online, but we started slightly much before that. And it's because of the efforts of the social welfare department and their vision to provide quality education to SCST and OBC communities. I think they're doing a wonderful job, and I could see that many of the students who came through these schools, they're in with flying colors, and some of them, and close to 100 plus of them, are in IITs as well this year. So there's some achievement. Apart from that, we have alternate building technologies, bioenergy cell, we're doing quite a bit now. Would like to bring a policy there, state bioenergy policy. Apart from that, we are trying to also work on a regulatory mechanism through the board, because now the bioenergy producers are fragmented and there is no centralized controlling facilities, because anyone and everyone is making biodiesel, and we need some sort of a control. Otherwise, spurious materials are the liquid is going to come out of it. So we need a sort of a regulatory mechanism so that people do believe that what they produce is biodiesel as well. And alternate building technologies, and this is developed by Center for Sustainable Technologies, and it's almost 4 decades now. Council with the CST since beginning, basically dissemination and demonstration of these technologies, and also helping people to build their houses. So it's a good number of houses have been constructed around Bangalore. I believe it's 20,000 plus buildings. And the interesting thing here is all of them are privately owned. that means the technology is here to stay. So just would like to tell you about how science and society can integrate and work together. See, whatever the S&T institutions or the R&D institutions that we do has to be relevant to the societal needs and aspirations. Otherwise, people do not themselves, integrate with the science. That's the thing. If I don't get the administrators and the policymakers and the public towards what we do in S&T institutions and R&D institutions, they don't appreciate what we do. So that's why we got to be more relevant, and we got to each time study what the society needs, and we need to work on that. Then only we become relevant. In that extent, I think Indian Institute of Science has pioneered that. Way back in '74, they established application of science and technology for rural areas. A cell started as an interdisciplinary research technology development center. Later on, probably around 2000, it got renamed, rechristened as Center for Sustainable Technologies. Basically, they look at many technologies. Some of them, earlier technologies were energy efficient wood burning stoves and wood gas and biomass gasification. Alternate building technologies is, to a certain level, sanitation, and then sustainable biomass for energy, forestry, and so on and so forth. Now, I think they have broadened their technology domains. That's the thing. Incidentally, I'd like to say something interesting here, because way back in '75, the founder of formerly ASTA, now CSC and KSCST, is Professor Reddy, thought it fit to have a center near Bengaluru, that is near Kungal. It's about 80 kilometers from here. He set up a center to live the rural areas and the rural place, to find out what their requirements in terms of energy, in terms of housing, in terms of water. And when you leave them and the center is in the midst of a rural setup, then you understand their problems, issues better. So that center did a wonderful thing. There we got the idea of what is the requirement of the society. Specifically in those times, it's especially meant for rural people. So that's why we could identify some of the issues which requires S&T interventions. So that way, we're grateful to Professor Reddy that these things could happen. And fortunately, many scientists from Indian Institute of Science, they participated and made some of these technologies which could be used by many. So just to give an example, I think energy efficient stoves in those days, we constructed close to 20 lakh plus, that's 2 million stoves. I think it's a big number. So then that's that's pretty much what is required in terms of how science approaches society. That means, you always keep looking at the issues of the people and just try to work on the areas of science and technology that could be intervened to suggest or solve certain issues of the society. So I think all of us pretty understand science is basically looks into logical, mathematical, and technological means. And technology is just application of science. I think this is quite relevant, and all of you do understand that. I don't have to specifically say that. So now coming back to what we do now, especially in science, technology, and society, we understand that science, technology, and society is an interdisciplinary program that primarily focus on understanding of relationship between scientific developments in the everyday lives of people. Pretty much the same. And just to inform what we do in terms of appreciating the societal needs, we have certain programs now. One is the biodryers, which is actually a product of Center for Sustainable Technologies done by the former faculty, Professor Lokras, which is still relevant. And we established a sort of a startup company, startup in the sense it's owned by KSCST. So in the Yadgir district, which is an aspirational district, to try fruits and vegetables when you produce in excess, and that could be later on fortified and given to adolescents and women. So this is one of the best projects that I could see because it avoids vegetable spoilage and post-harvest losses. And now we are into the process of getting this best fortified projects for all age levels and also the pregnant women. And we're going to have quite a number of products for different age groups, including it could be powder, it could be crystals, or it could be chicky kind of a thing, it could be liquid kind of a thing. And we're trying to get it for size certified, and once it's done, it's going to be commercially manufactured, and we plan to provide this to midday meal scheme of state government and also in Anganwadis. So this one thing is very interesting in the sense that what we do directly helps or benefits the people. The other one is, as I already mentioned, is e-learning center, which is being in a big way. And rainwater harvesting, I think we are very proud of it because everyone is looking at us, and now the government is looking at spreading it beyond Bangalore. That's very interesting for us. And just to end my talk, I think what we call science of today is the technology of tomorrow. We're going to have another 5 speakers today, and they are highly expertise in their own domains, and they'll be speaking to you. And I think you will be richer by listening to them today. And that's it. I'll end my talk now. Over to you, Anjani.
Thank you, sir. Thank you, Hemant, sir. Now I would like to welcome Professor Montomani, Professor in Center of Sustainable Technologies, IASC Bengaluru, to deliver a talk on Science and Society Sustainable Challenges. Let me introduce our speaker, Professor Montomani, currently working as a professor in Center for Sustainable Technologies, IASC Bengaluru. He pursued his PhD MTech from IIT Madras and B Architect from BKPS College of Architecture, University of Pune, India. His area of interest are sustainable architecture, design, climate responsive architecture, green building. Welcome to you, sir.
Good morning. Am I audible?
Yes, sir, you are audible.
Yeah.
Good morning, sir.
Can I keep my video off or it's required?
You can switch on the video, sir.
Yeah. And can I share my screen?
Yeah.
Yes, sir, you can.
Is the screen visible now?
Yes, sir, it is visible.
So good morning and thank you for inviting me for this event. I'd like to share the experiences I've had so far connected with science, technology, or taking technology to the people. And like what Dr. Hemant said, that our center's been doing this for quite some time. I'll just try to give a background with this slide. This is from a book called the Zero Energy Development Book. And what the book actually says is that satisfaction with life has a different context now, particularly with income levels being high for many people. Urban lifestyle has changed. But are we really happy? Do we have time with the family? Do we have time with friends? And then trying to map out the ecological footprint. Now, the ecological footprint is the land mass, the terrestrial land mass required to support the lifestyle that we have. A simple example is if we have a cotton shirt, it is getting grown somewhere, then it gets converted to fiber or yarn somewhere, then it gets dyed somewhere, then converted to fabric somewhere. So if we start apportioning the land mass required to support a lifestyle, then it is measured in terms of global hectares per capita. And here you will find that a lot of the poorer regions are much happier with a lower ecological footprint. Right. Now, the economy that we rely on depends on consumerism. That means that you need to consume more. And if you need to consume more, you need to produce more. And the industries want to produce more because one, profits increases. Second is their employment potential also starts to grow. So it's a very difficult context. We can't look at a very stagnant economy because we have agreed to go with an economy that goes with consumerism, right? Unless we change that mindset. The second part also is that increasing income has not really resulted in happy people, right? And this is very clear with how people buy mobile phones, because with the launch of every mobile phone, they are worried that the newer mobile phone will come out with more features, better pricing. So you're unhappy even with the products that you have, right? And with increasing choice, it actually causes more unhappiness than if you are having limited choices, right? So I will go back to the classic example of traditional housing versus modern housing. And modern housing can be still low energy housing, like what Dr. Hemant said. Our center has been looking at stabilized mud block, low energy. But even there is a difference between zero energy and energy zero. Zero energy is the house on the left, where they don't have electricity supply, right? So they don't require the modern energy that we utilize. They live a very simple life. They are healthy. Their income levels are very low. And all their requirements come from very close proximity, the vegetables, the materials for the house, everything. The dwelling on the right actually is a lab here, the center at the Indian Institute of Science. And we have photovoltaic roof. This is about a 10 kilowatt system. And we are trying to generate as much energy as we consume. And we call that energy zero, right? Both are not the same. Not requiring energy is different from generating as much as you need. They're not the same. And when we went into investigating these houses, what we call primitive or kacha houses, we found that their performances are way better than modern houses, right? In this graph, you can see the external temperature in red line and the indoor temperature in the green line. And you will see that despite temperatures going up to 40, 41, 42 degrees, the indoor temperatures are hovering around 30, 32 degrees, which means that the people inside these houses will be comfortable without the need for fans, without the need for air conditioning. And what we are also realizing is, particularly with COVID, the ventilation in these houses is very high. So the risk of infection spreading and cross-contamination and COVID and situations like that, these houses are far more safer than in our current houses where we tend to rely on fans and air conditioners. And when we look at end of life, these houses have no problems. We don't have to worry about plastics to dispose and toxicity, sending materials to landfill. So those issues are not there. Whatever materials are natural and nature takes care of it, right? And I hope you know that today microplastics are found in the lungs of people. It's found in the blood of people. And I'm talking about articles that have just come out last week. So we are living in an increasingly toxic environment, given that a lot of synthetics have come in. Okay, what do we do about it? And a lot of these synthetics have evolved because of science and technology. At the same time, society is suffering. How can society now again leverage science and technology to get back to an environment which is safe, which is conducive to social life and also health? Now, one challenge is aspirations, right? People aspire for a better life, better car, a better dwelling, better clothes, better mobile phone. So even in rural areas, these changes are happening. And these changes happen slowly and then they accelerate. So what we did is that we studied the impact of these changes. First the roof changes, then the walls change, and then the entire house changes. But what happens is that when a dwelling changes the roof, its performance in terms of climatic response changes. It allows a lot more heat, temperatures are much higher inside. and it becomes difficult to live in those houses as you were living before. And you start relying on fans and electricity and air conditioning, right? Which again increases our energy and resource footprint, right? And we did a simple life cycle assessment, and this assessment is something that we did more than 10 years back. We found that every house changes like this. It contributes to about 6 tons of carbon dioxide minimum per house, right? And if you take India and China for put together, have nearly 2 billion population who are rural, who are aspiring for a modern life, right? Where do we have the resources to cater to 2 billion people, right? So we estimated that these changes in houses actually contributes to global warming. And already the IPCC report, the climate panel report is saying that climate change is happening very aggressively. And we need to take concerted steps. We need to use science to now remove carbon dioxide from the atmosphere. You know, one approach is not emit carbon dioxide into the atmosphere. The second approach is to remove carbon dioxide, because without that, most of the parts of the world will become inhabitable, difficult to live. And this is again from a study that we had conducted. We found that there are two types of energy use in buildings. One is what we call embodied energy, right? Embodied energy is the energy going into manufacturing, transporting building materials, you know, construction, right? And the other is the operational energy. So right now, what we are utilizing to make this presentation is operational energy. That is, I'm sitting in front of a computer, the network is there, you know, LAN network is there, the Wi-Fi network is there. All those are operational energy. And if you see for traditional dwellings, the embodied energy is less than 2 gigajoules per meter square. And the operational energy is less than 1 gigajoules per household per year. And when we go to modern dwelling, there is a 4 times increase in the embodied energy and nearly a 40 times increase in the operational energy. Now you multiply the 2 billion people by 40. You will realize that how much of our photovoltaics we put or go nuclear or go wind energy, we will not be able to meet up with that much of energy demand, right? Because even if you go to rural Karnataka today, they are having, even now, when the government is saying they are energy surplus, there is still a 12-hour, 15-hour power cuts in rural areas, right? Now coming to adaptation, because our sustainability is about adaptation. And when we look at building clusters, individual, we rely on the building foremost, because we are spending about 80% of our times inside the houses, right? So we look at the adaptability of buildings, which means again, you look at, you know, structural safety, you know, safety against flooding, wind, durability of the material, you know, things like that. So we had conducted a study on climate change, and if climate is changing, then the regional climate also changes. Like a region which is warm, humid, can change to something that is much warmer, or it could become hotter and drier. So we looked at these scenarios and we started examining buildings, various types of buildings. And we looked at two types of buildings. The indoor temperature measurement is what we had evaluated, and the gray band that you see is the temperature at which people would be comfortable, right? And we looked at traditional dwellings, which we call vernacular dwellings, and we looked at conventional dwellings. And what we found is that traditional dwellings, the comfort inside is much better than modern buildings. Like you see these dots for temperature throughout the year. And if the climate change were to happen, we also find that traditional buildings are able to fare much better, right? Whereas the conventional dwellings, the temperatures are exceeding what we can naturally withstand. And then we'll have to rely on fans, air conditioners, or make modifications to the houses, right? So traditional dwellings, rural dwellings are far more suited to climate change, but they are trying to adopt modern dwellings, modern building materials, right? And even across the world, people are saying that the climate that was existing is changing. Even Antarctica is now saying it's much hotter than it used to be. And we also continued the study, and we found in 3 different regions, we looked at the kind of changes that are happening to dwellings. And we found, tried to investigate these changes and how do they reflect with regards to climate change. So one of the field stations we have about 90 kilometers from here that Dr. Hemant mentioned is a place called Sukenhalli. This is about 7 kilometers from the field station, but these are the regions that our field station had interacted with, provided technology for from the 1980s. And here again, we found that the traditional buildings are far more superior, particularly the warmer regions, in withstanding climate change. Right? This was published in a recent article in a journal called Scientific Reports, which is published by Nature. And we got a lot of positive feedback for studies like this. Again, today people are saying smart buildings are the answer, smart buildings can save energy. We are currently examining it under a concept called energy neutrality. And what energy neutrality means is that the smart network that you put in, the occupant sensor, the light sensor, light intensity sensor, all of these are manufactured in some part of the world, mostly in China. They're transported to you. They require energy for their operation. And we're trying to see over their lifespan of 5 years or 10 years, are they able to recover the energy gone into their own production, right? And how much energy are they saving? And we took an example of a motion sensor which came from Shanghai. It was delivered by Amazon. We looked at the shipping cost, the cost it takes, energy it takes for the shipping, because from the label you can find out where it is being shipped from. And we found that for a light like incandescent bulb, we found that the energy recovery is much faster. Okay, within about within about half a year, we are able to withstand we recover the energy. But when we go to LED lights, it is going to take us a lot more time, because LED lights have already become very efficient. Incandescent bulbs are not very efficient, right? So the whole context here is, with appliances becoming more and more efficient, we tend to use more of them. And putting up a smart sensor doesn't really help, but it actually increases the carbon footprint of the entire dwelling. So we are trying to come up with a study to find out where it is meaningful to put these sensors and where it isn't. So like you can see in this case, if you were to use a product made in China and transport it to Bangalore and install, the transport energy is very high, right? So it also comes down to the fact that even food, even other resources, we should try to consume as locally as possible to reduce the energy footprint, right? Now, again, coming to LED lights, we had investigated that LED lights have a problem, right? All our monitors today are coming up with this blue light filter. Mobile phones also have something called a night mode, right? This is because the LED emits a particular blue light in the spectra from 410 to 470, which actually causes retinal cell deaths. It causes sleeplessness. It causes emotional problems. It causes us to be impulsive, short-tempered, right? Nobody would really understand that somebody is short-tempered and impulsive because of working under LED light. And industry is already taking recognition of this. And we found the problem is because of this, the blue peak that you see. We studied, we examined the light in terms of different wavelengths for different types of natural light. We looked at our filament-based bulb, incandescent bulb, and we looked at LED. And if you look at it here, the filament-based bulb is actually the safest, giving us the light closest to natural sunlight. But those are the lights we are discarding today, saying they are not efficient, they are not sustainable, they are not green. And we adopt something which is actually damaging to the eye, but not so not so much in consuming energy. So in doing this, we were able to identify a filter which cuts off this light, this blue peak, We actually published an article on that. And this is a tape called Captown, which you can utilize to make your lights safer. And this has been adopted by industry. It has been, a lot of people have written to us, and we made this information accessible on the website. In fact, all the street lights in the Indian Institute of Science have been put up with these tapes more than 2 years back. So there is some positive impact we've had on society, and we are also hoping that doing these things uh, does not affect the nocturnal wildlife on campus. And on the last part, sanitation, this is again taking us back to about 2007, 2008, when we had provided sanitation for a coastal community impacted by a tsunami. And here, again, the societal part will stand out. Though the technology is there, the science is there, the know-how is there, societal acceptance is very important, right? And because they have aspirations, they look up to you, they say, oh, you are using a toilet, but you are telling us to build a different type of toilet, right? And this was a similar situation we faced, where we provided a eco sand where they use ash for cooking and can use the composted, human night soil for growing agriculture, growing crops. And we built about 140 of these toilets. We had come up with a design called the modified compact septic tank. And what it does is it also regulates the level of water in the septic tank, which means that even if the toilet were to get flooded during another tsunami or rainfall, the toilets resume functioning once the water recedes. And we had built these way back in 2006, 2007. And we had visited this in 2017. And we found that nearly 60 to 70% of them are still in use, which is actually a very high success rate, despite being in a very highly corrosive environment such as a coastal. So this was when we were building it way back. And again, these are some houses in Karnataka where we use rammed earth. This is again Dr. Professor Venkatram Reddy and Somshekhar, my colleague, were involved in this. So, and what happened is that finally, when it comes down to sanitation, people perceive it differently because they feel that sanitation, I want to go out in nature. So even if you provide toilets to them like this, they will not use the toilets, but use the space in between the toilets for privacy. They will still go out in the open. And very often they convert the toilets to store firewood. And even in our example, they converted one into a kitchen and one into a place to store firewood because they said that, see, your toilets don't leak. And it is very important that we need a place where we keep the firewood or the cow dung cakes dry. And we are also able to cook in a place where it is not rainy all the time. So the societal preferences and attitude also matters. So with this, I will stop. Today, with the context of sustainability now coming forth, people are questioning what is this low energy? What is this minimum pollution? Because we have been adopting low energy, minimum, all of these, but why is it that global warming is still happening, right? So the questions we have to ask ourselves is, can traditional lifestyles come back again? Can we learn something from traditional lifestyle? Is increasing use of energy efficient appliances really solving the problem of lowering the energy footprint, right? So we need to move from efficiency to being effective in lowering our energy footprint. And I will stop with this. If there are any questions, I'll be happy to take. Was I audible?
Yes, sir.
So if there are any questions, I'll be happy.
Okay. If anyone having a question, you can type in a chat box so that sir will answer your questions. Pradeep Kumar BM, you have raised your hand. If you have any question, you can type in the chat box. Sir, I think no questions. If they are sending a question, I'll forward to you, sir,
Sure,
so that
sure.
you can answer through a mail. Thank you, sir. Thank you for briefing about alternate building technology, green energies. Thank you, sir.
Thank you.
Um,
Yeah. Can I sign off now?
yes, sir.
Yeah. Thank you so much.
Now I would like to welcome Dr. S. Prithvish, Director, Academics Training, Sri Shankara Cancer Hospital Research Center, Bangalore. Welcome to you, sir. Before starting the session, I would like to introduce our guest, Dr. S. Prithvish, currently working as a director in academic and training in Sri Shankara Cancer Hospital Research Center. He providing guidance and support to exploring and facilitating method to improve training, teaching, curricula, evaluation in the health professional education in a leading oncology setup in Bangalore. Welcome to you, sir. Over to you, sir. Sir, you're muted. We are not able to hear you.
Yeah. Thank you, madam. Am I audible?
Yes, sir. You are
Can I share my slides?
Yes, sir. You can.
Madam, is it visible? Is the
No,
screen
sir, not
visible?
yet. No, sir, not yet.
Huh?
No. Yes,
No?
it is loading, sir. Loading.
It is loading? Okay. Once it is fully loaded, kindly let me know.
Sir, can you share once again, sir?
Okay. We'll come out and share. Is it clear? Is
Yes,
it
sir.
clear?
Yes, sir. We can able to see your slide.
Is the slide visible? Slide
Yes, sir.
visible?
Yes, sir.
You can start.
Yes, sir.
Well, thank you, Anjali. Good morning, friends, scientists, engineers, all interested people, Mr. Hemant Kumar, Anjani, and all from KSCST. Thanks for this opportunity to be part of this webinar. Especially, I will be looking at from the health sector, and the topic is the primary healthcare successes and challenges. Context, as you all know, and as Anjani and Mr. Hemant Kumar mentioned, the context is basically introspection during Azadi Ka Amrit Mahotsav. Well, I really feel proud when it comes to Azadi Ka Amrit Mahotsav and the health sector. My friends, I would like to share from 5 points of. Now let's just look at what is innovation. Let us look at public health successes in India and world and innovations observed evolved. What are the failures to learn from? Challenges ahead and the role of science and society and role of all of us. Especially, I am chilled that so many scientists are here and an organization like KSCST is organizing this Vigyan Utsav. Friends, I would like to take you to two small paragraphs here. Please look at from the Webster Dictionary. The words innovation and invention overlap semantically, but are really quite distinct. Invention can refer to a type of musical composition, a falsehood, a discovery, any product of imagination. Sense of invention, most likely to be confused with innovation, is a device, contrivance, or process originated after study and experiment, usually something which has not previously been in existence. Whereas innovation, for its part, can offer to something new or to a change made to an existing product, idea, or field. I repeat, innovation we refer to something new or to a change made for an existing product, idea, or field. One might say that the first telephone was an invention, the first cellular telephone either an invention or an innovation, and the first smartphone an innovation. Well, three innovations I remember, friends. This is what I recall. The first innovation in health system is the very idea of primary health care in the world. I go back to Alma Ata Declaration 1978. The primary health care requires and promotes maximum community and individual self-reliance and participation in the planning, organization, operation, and control of primary health care, making fullest use of local, national, and other available resources. And to this end, develops through appropriate education the abilities of communities to participate. Friends, this soft tool is a real innovation which comes to my mind if we want to recall the 75 years of independence. There is another one on communitization, which is the only major area which we in India have contributed to global public health system jargon. Definitely worthy of Azadi Ka Amrit Mahotsav. It is the pink sari clad Asha workers you have seen in the villages. These Asha workers, Anganwadi workers, the Panchayat workers, they are the best innovations, the soft innovations in the health sector. The recent COVID pandemic response has also shown their potential, since without them, health workers, professionals, police, vaccinators, responders could not reach the people. The Asha Akka or Didi is very well known throughout the country, across the country, in every village. Friends, we have the support of Constitution of India, the National Health Policy, the various committee reports from Boer Committee from 1940s till now. I would like to specially mention that these are the other three things which we remember if we look at the 75 years. Well, I thought with you, I will propose some of the public health successes in India and the world and innovations observed, evolved. See, there have been public health successes. Just imagine at the beginning of the 20th century, 1900, the life expectancy of our country, people used to live not more than 32 years. Today, they live up to 67 years. That means health system has evolved, it has developed, it has contributed. Same thing in Spain, in Europe, in Belgium. We see them people instead of 67 living up to 85 years. Public health successes in India and the world. Some of the examples include, see, look at smallpox eradication, a global campaign, the biggest campaign. The vaccine, effective vaccine was responsible. Absence of non-human reservoir was another contributory point. Eradication of polio. We don't find children with polio lameness today who are of younger age. It's again because of the vaccination campaign, awareness, among a lot of money, time spent by health workers. The third is the guinea worm disease. A very important thing which played a role here are the step wells. The step wells were abolished for use. Next, see, when I entered my post-graduation after my MBBS in 1982, people laughed at when Prime Minister at that time, Mrs. Indira Gandhi, talked about eradication of leprosy. But today, after 40 years, I myself seeing the leprosy coming down, effective treatment, communitization, domiciliary treatment, these have helped in a very big way. Here the innovation is the domiciliary method of treatment for leprosy. Similarly, domiciliary treatment for tuberculosis has helped. If we look at HIV AIDS, after 1985, when I was working in an international NGO called ActionAid, it was a time when HIV AIDS just entered our country. The simple process of counseling spread across the country. This was the innovation which is helping today that we are in a better position when it comes to HIV/AIDS. The control of malaria, because malaria is not eradicable. Alexander John Sinton in the early part of the 20th century even developed a mathematical model where lakhs of deaths occur due to malaria. The malaria eradication program brought malaria under control. See, friends, mitigation of pandemics of Spanish flu in 1920s, bird flu, SARS, chikungunya, dengue, and the most important thing, COVID-19. These efforts which have been made, they are the innovations. I would like to bring to you one more very important area, the public health successes again, the reduction in maternal mortality rate. Here, improved MCH care, literacy, provision of health services helped. Reduction in infant mortality rate, it was more than 130 in 1979 when I studied MBBS. Today, the same thing is less than 40 across the country, much more less in Karnataka. Increase in life expectancy. People in India live up more than 67 years now. That means the health system is working. Since scientists are here, a couple of things come to my mind. See, the oral rehydration therapy, the oral rehydration salt, the WHO formula for correction of dehydration is a definite innovation. The under 5 card for monitoring growth of children used in all the Anganwadis is an innovation. The bangle in Africa, the mid-arm tape for measurement of nutrition status is an innovation. Treatment of upper respiratory tract infections by village level workers. See, one Dr. Abhay Bang did this in Agricholi project. It was accepted by the country, by the World Health Organization. The treatment of ARI, acute upper respiratory tract infections by village level workers itself. Here the demystified personnel instead of the doctor. Similarly, dots, clots approach, where we directly visit the house. In front of us, the patient takes the treatment. This approach helped control of tuberculosis. Similarly, if we look at instrumentation, laparoscopy has helped in planning, family planning, surgeries, especially tubectomy. Another important area is low-cost drugs. This has been a possibility, but we have done only 5 milligram of 100 milligram, which is possible. Primary healthcare itself, the very approach of primary healthcare itself is an innovation. The Alma Ata Declaration, friends, today in more than 6 lakh villages of the country, they are covered by the primary health centers. They are covered by the sub-centers. Every 3,000 population is covered by sub-centers. Every 20 to 30,000 population is covered by primary health centers. Post-independence, we should be proud of. Every village has an Anganwadi worker. Every village has an Asha worker. Anganwadi worker, the ICDS program. This is one of the very good innovations. India is doing well on this. Community-based rehabilitation of persons with disabilities. Not much has happened, but there is a lot of potential for that. Where we train the mothers to address a child with visual disabilities, to train the mother to address communication disabilities, mental retardation, cerebral palsy, with inputs of education, activities of daily living skills, and accessing resources. The most current innovation, I would say, is universal health coverage to ensure that irrespective of caste, creed, poverty, richness, everyone gets universal health coverage. It has just remained an idea and a dream. It requires a lot to be invested, lot of efforts to be put to make it a reality. I would like to use the word limited success than failures because there have been good effort, but very limited success. More effort is required in these areas where our total health outcome can be better. Number one, integration of indigenous systems, especially we are rich in Ayurveda, Siddha, we are rich in homeopathy, Unani, Tibetan medicine. We have not been able to integrate these systems effectively into the primary health care. The cost of healthcare is increasing. We all should work towards reducing the cost of healthcare. Health insurance scheme. If you look at the health insurance in Europe today, I tell you my experience when I went to Belgium and a few other countries in Europe, interacting with the family practitioners and the patients. I met many of the geriatric patients more than 70, 75 years. When I asked them about healthcare, they told me, you don't know, my friend, everything in my, whatever I need is covered in my country. If we go to Sri Lanka, the health insurance, health coverage, government promises 100%. We have health insurance schemes, but organized sector is covered better. This is one area where if we don't work hard, people will sell their properties to seek health care. This health insurance is an area which has to be addressed. Government-private participation in public health together is happening in pockets. This is another area with limited success. What are the challenges ahead? A couple of things come to my mind, especially when I find engineers, scientists in this group. Challenges ahead are achieving universal health coverage, community-based rehabilitation of persons with disability. See, even after so many years after independence, tackling malnutrition has been a problem. Malnutrition, even today we see children with third-degree malnutrition, second-degree malnutrition. Malnutrition doesn't involve only giving food. It requires the improvement of the family circumstances, social circumstances, economic circumstances, emotional circumstances, plus extra feeding. All these only can look at tackling malnutrition. Here, the societal role is 100 milligram. Unless society participates tackling malnutrition. So here is one area where science and society, major role in universal health coverage, in community-based rehabilitation of persons with disability, and tackling malnutrition. Now, with the reduction in communicable diseases, the prevention of non-communicable diseases, I will use the word prevention rather than treatment of non-communicable diseases. Cancer, stroke, coronary heart disease, diabetes mellitus, suicides, mental health issues, injuries, road traffic accidents. We must gear up and put up more and more efforts towards its prevention. Engineers, I have a homework for all of you. Please suggest a method for liquid waste management in sub-centers, primary health centers, community health centers. Better methods of healthcare waste management. Sanitation, not only in normal, but also disaster situations. Drinking water, scarcity is a problem. Drinking water availability, we have not solved 100%. Waste management is a problem. I consulted metallurgists from Indian Institute of Science. See, plastic is recyclable 7 times, not beyond that. High surgical steel is used in medical faculty. So melting point is high. Recycling has limited value. Making new steel may be cheaper. Glass recycling, intact glass may be possible, but not broken glass, which may be costly. Friends, we are just even now looking for a good needle cutter to prevent needle stick injuries and proper management of needles. Solar energy for preservation of vaccines is being tried, but it requires more and more effort to make it a reality. One of my friends in Arunachal has tried solar powered hearing aid. We need solar power usage much more. There is a lot of potential when it comes to innovation in requirement with reference to equipment. I would like to draw attention of KSCST to this area. The health science education must reach each and every individual if we want to realize universal health coverage. It has to be community-oriented training, interdisciplinary holistic approach, severely more practical orientation to training, organizing, assisting health teams, practical field-oriented training in epidemiology and health education. Teaching should include sociology, human behavior, social political structure of the society, management, training in close collaboration with healthcare services, training in public health through chain of public health schools. Our community has to be empowered. We should look at communitization as an innovation, as a strategy, combining as an empowerment of community to look at community, universal health coverage, community-based rehabilitation of persons with disability, primary health care, empowerment of individuals. The role of KSCST, I have been watching from the last 30 years. Whatever science you teach for the common man, it has a lot of value. Please have strategies to teach healthcare sector part also more, combining best elements of tradition and culture with science and technology. Promotive, preventive, and curative function. Democratic, decentralized, and participatory. Oriented to people and vulnerable groups. Economical. Rooted in community, involving people, increasing capacity to solve problems. Training personnel, producing drugs and material, low-cost drugs. If we do it, it is going to make a lot of difference. There has been an attempt concrete last couple of years by Government of India. It needs a lot of adrenaline to realize it and to make everyone finding it useful. Role of science and society. Again, KSCST comes to my mind. Your role is simply very big. One of the most important thing of science and society, if we make every individual aware of every aspect of a disease, its prevention, its control, and have measures to motivate, the awareness of common man about science behind everything in healthcare is most important. There should be incentive, promotion for encouraging innovation among students, health workers, doctors, nurses, common man. Evolving health insurance scheme, if we don't do it, everyone will sell his property to take health care. My friends, in a lighter vein, I want to put a few slides for you. The right mindset for innovation. Innovation requires more creativity and willingness to take risks than the implementation of typical projects. To successfully realize innovation projects, a different mindset is needed. I took it from internet in some of the areas. One of the things innovation is break the rules. What is the most important rule? To break the rules. With traditional approaches and conventional methods, you will often not get anywhere in the field of innovation. Challenge the status quo consistently. Explore new paths of the beaten track. Collect ideas everywhere. Innovation projects constantly need new ideas to overcome obstacles, to change concepts, and to optimize strategies. Believe in the impossible. Imagine how your innovation will look like in reality, and believe that you will be able to overcome all obstacles on the way to realization. Put together an innovation team of individuals with different perspectives and thinking styles. My friends, it's really very interesting to be part of all of you. We all let us work together. One of the most important things is awareness of the community towards science behind healthcare, all aspects. Our villagers, now the literacy status, what used to be 20% among women, now it is more than 60%. We have mobile technology, and we have to move towards from awareness to motivation. Friends, the door to opportunity is always labeled push. Are we ready to push communitization? Friends, thank you very much. And thanks to KSCST for this opportunity. Thank you very much.
Thank you, sir. If any questions, participants can put in the chat box.
Professor Kondaya has raised the hand, so you can keep a message in the
please.
chat box, sir.
Yes, sir. Professor Kondaya, sir, please. Professor Kondaya, sir, please.
Okay. Kondaya, sir, you can unmute now. So you can unmute and ask your question.
Please, sir.
So maybe there are no questions, sir. So if any questions,
okay.
oh, he kept the question, sir. How do we integrate traditional medicine with allopathy?
Yeah. Well, thank you, Professor Kondaya, sir. This integration of indigenous systems with allopathy is a
For the questions.
big challenge, but it is possible. Am I audible, Anjana? Anjana,
Yes, sir, you
am
are
I
audible.
audible? Yeah. See, there have been attempts in terms of policy in Government of India, in terms of state policies. See, when it comes to integration, it is possible of integration of systems, but integration of medicines is not a possibility. That's why one of the very important ways, I was in a conference with the Siddha medicine recently, and with the Government of India, what we thought was one of the best things is in all allopathy setups, we should have the systems of Ayurveda, homeopathy, systems of Tibetan medicine, systems of Siddha, which is evolved from Tamil Nadu. These should be it should be system integration, not integration of medicine. One of the places where I saw this integration going well is Dr. D.Y. Patil Medical College Hospital in Mumbai. In that place, we have the Ayurvedic dispensary from the last Ayurvedic health center with allocated beds in an allopathy setup. Similarly, we find such a setup in MS Ramaya Medical College and Hospital. We find such a setup in Shri Shankara Cancer Hospital and Research Center. Here, the integration is not of medicine, it is integration of the system within the health setup. It is a possibility, and it has been tried out. Even in Karnataka government, in many of the primary health centers, there has been an attempt to have an Ayurvedic doctor with Ayurvedic medicine. So we have a policy, we have some examples, but making it increase the scale of operations is most important. And there is a lot of opportunity in our country, and we have to make use of this resource. One best example we find is Tamil Nadu. The Tamil Nadu, especially, every village, we have a Siddha practitioner. And there is a lot of opportunity for integration there. Every village in Tamil Nadu has a Siddha representative. And Professor Kundaya just now mentioned about the resistance from the allopathy doctors. Sir, I agree with you, but at the same time, I would like to specially mention that all these things we will have to overcome. And all this is possible since we have a policy. We have to bring together the systems, we have to develop models of integration and promote it. And it is an advocacy issue where we have to educate the allopathy doctors also in this context. If we go to Punjab, if we go to Kerala, we find Ayurvedic practitioners in a very big way. One of the things we must always do is the Ayurvedic practitioners should not practice other medicine. And allopathic practitioners should not look at the using Ayurvedic medicines, but system integration in the health setup and understanding within the health setup. If it is there, then the competition will be lesser. Our objective should be more towards helping the people, helping the society. If that is the objective, this opportunity of integration we should make use of. Most of the time it has remained in paper, except development in select places. Thank you for that question, sir. It's a very challenging thing.
Thank you, sir. Thank you for the wonderful speech. Thank you once again, sir. Now I would like to welcome our next speaker, Professor L.S. Chashida. He's a professor and dean in the Ashoka University. He is specialized in genetics, molecular biology, and evaluatory biology. Professor Chashida did his undergraduation and post-graduation studies in the University of Agricultural Science, Dharwad, and holds a PhD degree from the University of Cambridge, UK. He started his independent research career at the Center of Cellular and Molecular Biology, Hyderabad, as a scientist and a group leader, where he is built a strong development biology group. Following that, he moved to IISER Pune and contributed to its growth since its inception.
Hello, Nidhi. Ella, Parala. I will call you back in the evening.
Welcome to you, sir.
I have seen both, I will tell you.
Okay, thanks, Anjani. Can you hear me?
Yes, sir, I can hear you.
Let me start. Ellargu namaskara. Thank you very much for giving me an opportunity to be here today, particularly to celebrate the 75th year of independence and also the role of science and technology in shaping our, post-independent India. So what I will do is, I think most of the time when we talk about science and technology, we talk about technology actually, not so much about the science itself. The science and technology are two different things, but they are interrelated. Technology drives science. For example, without telescope or microscope, modern discoveries would not have happened. At the same time, science also drives technology, like your mobile phone or space research or satellite communication and so forth, right? So there is something beyond this technology in sciences for social good, particularly in the context of understanding ourselves, understanding our society, understanding our environment, understanding life itself, biodiversity, and and how we can actually make use of the science education, scientific understanding for betterment of the society. So I'll sort of discuss this in the context of India and what we have achieved in the last 75 years. Okay, and it's a remarkable story. I cannot, narrate everything today. I'm sure many of you have read, many of you already know. There are a couple of books which have come out on this. One of them I myself edited on behalf of Indian National Science Academy. And when India turned 75th year of its independence, we came out with a book on role of science and technology in transforming India from what it was in 1947 to what it is now, which is the fourth largest economy. And in 1947, we were almost begging for food. Food was coming as donation, and there was absolutely no major industries in India. Employment was only in the government. There was no outside government employment for our students. And number of colleges, number of research institutes are very few for, producing new knowledge or use the knowledge for betterment of the society. From that 1947, where we have come now, there's a big role for science and technology to play here. And the same science and technology, how we can use for the future of this country post 75 years is what I'll discuss. I'll try to do this in the next 20-25 minutes, and then we can have some discussions. Let me share my slides. Can you see my slides?
So it's loading, yes.
Okay. So why is it not moving?
So it's not in the presentation mode.
It is in the presentation mode.
Ah.
Okay, maybe
Now it's moving.
this is, no, I think what happens sometimes,
When we
Google,
go,
yeah, Google has a problem with that. I think
Yes.
what I'll do is I'll use this mode.
Okay,
It's
sir.
easier this mode, because sometimes it, it's not going in this presentation mode. Because I use Apple Mac both for my presentation as well as for my camera. So sometimes there's a mismatch with Google. It works well with Zoom. So, what I was trying to sort of, discuss today is science for social good beyond technology. It's not about our defense technology. It's not about space technology. It's not about even the food technology, right? Something beyond all of these things. But of course, I'll sort of go through, what we have achieved both in science and technology. So first thing, I'm sure I don't need to give this particular piece of information for this audience, but still for setting up the right, background. Science is pursuit of knowledge that is beyond our sensory perception, right? So because it has to be beyond our own perception, invariably it has to be unbiased and objective. You cannot call something called scientific knowledge if it is already biased or, not objective, because that can't be beyond our own perception. Because if it is biased, that means it's my opinion. If it is not objective, it could be my, way of observing things, my individual opinion. It could be one entire humanity. This picture I'm showing you here, which all of you know, the relationship between the moon, earth, and the sun, right? Every day we see sun rising from the east and setting in the west. All the 7 billion people see exactly the same thing. even if you think that it's an unbiased observation, but it is not reality. The truth is something different. What science has enabled us to show the world or the universe, both microscopic world as well as macroscopic universe, is something which our eyes, our ears, our nose, our other sensory perception cannot perceive. None of the human beings can perceive. That basically makes it completely unbiased and more objective. It's not about Indian science or American science or European science. Even that can be biased. If it is simply all human beings see something, that's all could be biased, because our sensory perception itself is limited. We can see only certain distance, we can see certain size, we can see certain time scale, perceive certain time scales. But beyond all of these things, there is a world that exists, and that's what science discovers. You can use this scientific method of collecting evidence and validation of hypotheses in an unbiased way through a method of falsification to look at anything. You can even look at our own history, our own archaeology, our own environment, and including our economics. What kind of a social benefit? Recently, when Nobel Prize was given to Abhijit Banerjee and Esther Duo, the pair actually used experimental science to provide ways of how to distribute the government-sponsored welfare to poor people effectively, right? So you can use scientific methods to address any question or any social problem, and because that will provide you an unbiased and very objective way of understanding the problem and solving the problem. And once it's unbiased and objective way of solving the problem, that problem solving will also become more sustainable. Now, if you just trace Indian history and since independence, this is the book I mentioned, we edited in 2018. And, when India became independent in 1947, and then Prime Minister Nehru said we should give more emphasis on science education and scientific research, not only to improve the scientific understanding of the world, it's also about solving the societal problem. That was a time when we were with the problem of poverty and hunger, and also scientific temperament for peaceful and harmony in the society. And that's how we started all the science and technology related programs in the country. AAC was the only major research institute at that time, which is in Bengaluru, which is started in 1919 by then Mysore Maharaja in collaboration with the British government as well as with Tata's money. And IITs were started, many new universities were set up, Central University, and a large number of research institutions were set up around that time, including some of the public sector, which are science-driven or technology-driven programs, like in Bangalore itself, Bharat Electronics Laboratories, BEL, BEML, Bharat Earthmovers Limited, BHEL, Bharat Heavy Electric Limited. All of these basically were providing technological solutions to the societal problem, but that technological solution was possible because we had scientists who understand the technology. Because the science, without the scientific understanding of the technology, you cannot deploy the technology effectively, right? If you simply borrow a steam engine and bring it here, or a turbine, bring it into India, we cannot effectively use it. But Indians, having learned the science behind the technology, it could be heat transfer related topics in physics, thermodynamics, fluid dynamics, right? Or fluid mechanics. They are the ones who actually understood the technology, modify the technology for Indian context. It is simply not that we bought something and put it in India. Even the technology it was donated to us, or even the technology we bought from outside the country or built within the country, all of these had a very strong scientific basis, right? And that's what enabled India to fast track its development, and which helped in solving the food problem, self-sufficiency in food, self-sufficiency in very different other scientific and technological needs of the country, and also providing avenues for new innovation and new technological development, not only for India, for the rest of the world itself. For example, IITs, they are the ones who are basically the synonymous for modern Indian economy, symbolic of Indian confidence in modern science and technology, right? And this enabled India to turn around in its economy. 1991, July 24th, then Finance Minister liberalized Indian economy. And that liberalization was possible because we had a strong economy by that time. You cannot liberalize economy when the economy is not strong enough, right? When you are continuously dependent on donation from outside the country or from any other way, you cannot liberalize economy. You can liberalize economy when you have a really strong, right? That's what happened in India in 1991, because the previous 50 years of post-independent efforts enabled us to open up our economy. And that's what you see in the last 30, 40 years of growth of India was all because this foundation was given in the first 50 years, right? And, and now it's one of the largest economies in the world. And food, not only we produce enough for the whole country, we have enough reserve for next 2 years in case there is no food production for the entire 1.5 billion people, and we also can export, and we in fact donate food also. I'm sure many of you have heard about it. We also achieve nutrition security. It's not simply about food in terms of what calories you get, but you also need certain nutrition. One of the major source of nutrition is milk, and we achieve the security of nutrition by increasing the milk production and using the technology for preserving the milk and supplying door to door to the entire country. As many of you know, those who are in my age or my father's age here would know that as late as in 1990, it was difficult to get milk after 9 a.m. in the morning because there was no refrigeration in most of the shops, and you had to get the milk from the milk vendors early in the morning and boil it and keep it at home. In case you forget that, miss that, you will not be able to get milk until the late evening again or next day morning. And we also achieved, the health security because we provided healthcare much affordable. Even today, the best healthcare in the world is available in India at much affordable cost. Of course, there is still large population which do not have access to good healthcare, large population which do not have good access to nutrition. It is the social problem of unequal distribution of resources. But at the production level, at the quality level, we have achieved what we can provide to the entire Indian population. There are still problems, we still have that. Okay, we cannot deny that. In the context of IT revolution, this is where I just give you one example when I mentioned it's not simply about bringing technology to India and using it. It's also about using it in a way it is customized for Indian context, and also in a very innovative so that you actually can make use. You don't have to read the entire, the chronological order of how IT revolution happened, not only in India and the entire world. Anyway, in the context of India, the first computer to India arrived in 1955 to ISI Calcutta. The second came to TIFR Bombay at the same time. A year later, a third computer came to India to Indian Institute of Science, Bangalore. All these three computers were used for research purposes. The fourth computer came to IIT Kanpur in 1960, somewhere around that time. What IIT Kanpur did was, because it's an engineering college or education center, they introduced BTech Computer Science in 1963-64. That was second or the third BTech program in computer science in the world itself. The first one is in Caltech, right? And the second one is also in somewhere in California, you think UCESF or somewhere, or Stanford. And India started the third degree program. And those graduates are the ones who actually enabled building of big companies, IBLs and Intels and Microsoft, and also, developing computer science as a main source of technological services from India to the entire world, right? And that's what made India what it is today, right? And of course, our space ISRO success, it's written always in golden letters. And not only we have a completely indigenous rockets, indigenous technology, and engine technology, fuel technology, and we have been able to provide now services to other countries in launching their satellites, right? And we have, as you know, sent rockets to Moon and Mars and so forth, right? All of these things possible because as a society, we have some understanding of science and scientific methods. It's not the knowledge. Science is not about content of physics, chemistry, math, or biology. Science is about methods of, understanding something, methods of inquiry, right? That is what science is all about. And if you look at Indian traditional logic and mathematics, right, we have sort of deep-rooted, not only interest, certain skills in logic and mathematics. And so in a way, when modern science came to India during British time, in the beginning of the 20th century or late 19th century, India quickly adopted modern science is because modern science is built on logic, right? And rationality. And logic and rationality is something the Indian strength, right? We question our own belief system. Even if you look at some of the shlokas in Upanishads and all, you actually question the even existence of God. You question the variety of different aspects of our surroundings. And because you always think that simple observation using our sensory organs like eyes and ears is not enough to understand the world, and there must be something, reality must be something beyond this. And this ability to question, ability to challenge the existing knowledge, the irreverence, right? Irreverence is actually asking the questions to your teachers also, right? That's what was already there in the population, and that actually enabled to adopt the modern science very quickly and use this for social good. And I sort of divert from here to the next part, which I want to talk about, is beyond technology, what's the importance of science, where we need to still do a lot, and we need to bring in more. We have achieved to some extent. I'll bring that some of the elements, and then what else we need to do, right? Now, all of you have asked this question about what is life, who am I, what is self means, how do I know, what I know, and so forth, right? And much of this answers has come in modern biology, particularly, understanding the evolution, and from origin of life to evolution, we have sufficient understanding of life, and we know it's a DNA-based life, and what is DNA, and the chemical level, and how the information is coded, how information gets decoded, how very different parts of our body functions, and how they are all well connected, coordinated, and so forth. And we also know the method by which information gets copied and go generation after generation. If I inherit DNA from my parents, not only I inherit certain specific features of my parents which are different from other human beings, I also inherit two more things. I inherit the fact that I'm a human being, the features of all the human beings. I also inherit the features of life itself. If I'm a living organism, because the certain features that are required for living organisms are transferred through this genetic inheritance from my parents to me. So I born as a living organism. So we have sufficient understanding of the life at variety of different levels, at the molecular level, at the cellular level, at the organism level, and at the population level, and at the ecological level, right? And we also know what is the reason why we have some variations. For example, if I'm born to my parents, I may look different from my parents. Me and my brothers look different from each other. Me and my cousins look from each other. And what is the source of these differences, variations? We also know that. I'll not get into details. I'm just telling you that we know now sufficiently about that. So we have now a better understanding of not only chemical basis of life, and from at the self-assembly of very different components of life and how they actually bring out this very complex phenomena called life, and how this life copies itself, like, copies itself means basically procreation, and also how it evolves with time. That means we continuously adapt to new environment, changing environment. And that's what we see, the huge diversity of organisms on Earth. For example, the modern human, we actually had many new species of modern humans evolved over the last 5 million years. Only one survived, that is us, Homo sapiens. In fact, as recently as 30,000 years ago, there were 4 different species of modern humans who lived at the same time. In fact, they also met with each other at the same space too. And we have inherited many of those genomes. For example, many of our Indians, all of us, have genomes of not Homo sapiens. We also have genomes of Neanderthalensis and Denisovans. Those are 2 other species of human. Because of interspecific hybridization, we have inherited those ones. That means we lived more than one species lived at the same time in same space. Now, coming to Indian context, India being a very unique geological landscape, people who came to India while modern humans were spreading an entire world, from out of Africa to Central Asia, from Central Asia to Western Europe, west towards the Europe, and towards the east to Russia, China, India, and the north, Far East, and also from the Siberian Russia, from Alaska, and they went into Americas, both North and South America. So basically they spread the entire world. But in the early time of when people were spreading to the entire world, India became a very interesting land mass. On the north, you have Himalayas, very difficult to cross. In the south, and all the 3 sides we have sea. So India became a sort of a trapped land mass, but at the same time extremely rich in soil properties. And most of the people who moved to India post-agriculture revolution, they actually knew how to do agriculture. So these very different river basins provided a fantastic, opportunity for them to live and follow agriculture. And so that's why India became a mostly agriculture-based, culture. But at the same time, it became a melting pot of genetics and culture. India has 4,600 unique, well-defined populations, anthropologically distinct population. Many of them are tribes. Some of them are still primitive tribes. We have language, culture, social structure, dress and food habit, marriage practices, physical appearance, and of course, genetic architecture. So this unique diversity is what India represents, and it is our strength. Now, if you look at if you try to understand, this is where the scientific understanding of our own, the existence of life on Earth and our own evolution, human evolution, and our own, as Indians, what we are in India, and our own relation between our families, my relation with my parents, my brothers and sisters. This modern scientific understanding is actually very useful. It's not making us less human. It actually makes us more human. And this knowledge should make us humble. In fact, you always say that, right? More the knowledge, humble you become. That very traditional Indian statement. Always you see, whenever you talk about the knowledgeable person is more humble than a less knowledgeable person, right? And there is also an interesting, component to this. That once you understand the human diversity, we have a genetic diversity, physiological diversity, language diversity, culture diversity, and every individual is different. Although I may belong to one family of 3 or 4, brothers and sisters, but each one of us are different. And me and my cousins are just one step different, and my cousins and next second cousins are one more step different. But it's a continuum. We are only a small minor differences compared to how similar we are among all human beings. This makes us feel that, get a bigger picture. Supreme Courts, not only in India and all over the world, are upholding the human rights, equal rights to everybody, irrespective of gender, irrespective of their, where they live, what kind of skin complexion they have, what kind of language they speak, what kind of sexual orientation they have. Everybody should have equal rights on this world. This modern understanding of human rights came because of our, deep understanding, scientific understanding of human evolution and our own existence on Earth. Now, the second aspect of following scientific methods is, unlike in any other endeavors, in science, what happens is you make an hypothesis and you want to validate your hypothesis or test your hypothesis. And the methods of testing hypothesis is a process of falsification. That means you want to first make an hypothesis, you want to falsify the hypothesis. By series of tests to falsify the hypothesis, let's say if you have not been able to falsify the hypothesis, that means your hypothesis is correct. But if you design a test or an experiment or a new observation, whatever it is, a test can be anything, to say I want to prove something, invariably you are biased towards designing the test to prove something, right? And invariably you prove something, right? But if you say I am wrong, my hypothesis is wrong, let me test and show that it is wrong. But when you try to show that it is wrong, and if you cannot prove it is wrong, that means it may be correct, right? This is a method of science we follow. And this requires extreme honesty, because you have to first claim that you are wrong, right? How many of us in our world, in our day-to-day life, we claim that I'm wrong? But scientists every day, they say I'm wrong, my hypothesis is wrong, my null hypothesis may be correct. I want to test that, show that my null hypothesis is correct. That means my hypothesis is wrong. And then use all kinds of scientific methods, statistics to disprove your hypothesis. But if you cannot disprove, you say perhaps it may be true, and then you ask someone else to prove it, what's called peer review, right? So the entire world, you tell them, this is what you observed, and why don't you test it? Other people also will test it. And this, without peer review, you cannot even publish your work. Without peer review, your science is not considered as real. So this method of science will make you more honest. You have to follow with certain integrity, ethics, values, and everything. Because once your honesty is part of your profession, automatically it gets spill over to be a person of high integrity, high ethics, and values, right? People always think that, oh, science doesn't talk about ethics and values, and for that only religion is this one. Even if I'm an atheist, of course an atheist, I follow science, but I can be equally honest and follow ethics, is simply because my profession cannot progress without this honesty and ethical conduct. And that will have an impact. How I treat my neighbors, how I treat my other people in the society, how I take decision, how I pay my taxes, right? How I drive my car in the street. Everywhere I bring my scientific honesty and integrity, because otherwise I'll not be a true scientist. Last 2 minutes. And what is, in the future, particularly if there are students here, the world is changing too fast. Fast means you cannot make sufficient predictions the future world. When I did my undergraduate studies, and I was in Dharwad, and I could actually make that, next 5 years, this is what I want to do. And I actually pursued that 5 years, and the world was more or less the same. I could manage, I did my PhD. After my PhD, I wanted to do this, and I did this, and I already had that I want to do this kind of research, and I could manage to start my research. But in the modern world is becoming less predictable. You may think that I want to take up the job. That job may be gone. For example, in 2000, 2005, every young kid in the country wanted to become an employee of a call center, right? But there are no call centers anymore, because you have app-based services. You have AI and ML, into the app-based services. You don't need human beings to run the call centers, right? So that call centers are almost gone. So that job is gone. If you had prepared yourself to become an employee of a call center, that job itself is not. Then what do we do? How do you prepare yourself for a job which is not even there now, and it may come later? The second problem in India and all over the world we are facing is the problem of the climate change. Extreme weathers are, becoming a problem, and this is affecting our food, our quality of the food, and also our quality of our life. And it may have even much more, problem later. And overall, there is more inequity in the society with respect to how much we have achieved since independence. and the sustainable, and also the current mode of development is not sustainable. I'm sure those who live in Bangalore know how much is a problem of unplanned, rapid growth of our urban ecosystem, right? So we need to change the way we develop, for which again you have to use modern scientific understanding of the world. Right? So, yeah, some of the, for example, we need to worry about alternate source of energy. We have to worry about reduction of energy, because, simply saying that, we continue to live the way we are and somehow bring more green energy. Where is the green energy? Even if we talk about solar panels, what do you do with all the old panels? We cannot continuously generate this waste, electronic waste and other waste, which are also going to bring a problem to the society, right? And we need to take care of our water. Water is going to be the main problem, for all of us. And Bangalore is definitely one of those affected, and entire Karnataka and most part of India too. And, we need to, see, if you look at the rainfall in Bangalore not only can sustain its own, Bangalore can supply water to other nearby towns. Instead, we are bringing water from 100 kilometers, 200 kilometers to Bangalore. It is simply because we are not planning the water conservation, and this is where need a city level water grid and continuously harvest the water. And the amount of rainfall that happens in Bangalore, you don't need really to bring water from any of the Kaveri or Lingamaki or anywhere from outside the city. And of course, afforestation. And because there are more and more urban ecosystems are coming up, obviously we have to go for urban forestry. It's not simply a park. We have to have an urban forestry. We need to have a local biodiversity represented in your, in city parks and so forth. Not only to increase the, carbon sequestration, it also to restore local biodiversity. If otherwise you will have continuous to have this mosquito problem and other unwanted plants and insects, and which will affect our health, overall one health, not just our health, and also the health of the wildlife, unless we restore local biodiversity through afforestation methods, right? And all of these requires obviously awareness of scientific methods and scientific education, and of course research and action. All of these things have to be combined, and hope Karnataka Science and Technology Council will sort of bring all the central government, state government, and NGOs working in this area together and address the problem very comprehensively. I think it has to become a social movement. The way we had a freedom movement pre-independence, or a social movement at a certain time of crisis. This is that time where we need to have a consolidated effort and to address some of these problems. And I hope Karnataka Science and Technology Council can take the lead in this endeavors. I'll stop here. Thank you very much.
I think this has been thought-provoking talk by Professor Shri. I appreciate, sir. I think we made today is the best day for this specific topic, and appreciate your time and efforts to make this possible. I think as advised, I think council will look into bring all other organizations working here to make it as a movement, not just once in a while seminar or webinar. I think we'll do that. Thanks very much for
thank you. Thank you very much.
Today. Yes, yeah. Go to you. Yeah.
Thank you, sir. Thank you, Chashida, sir. Is there any question from the audience? Any queries? If any queries, you can type in a chat box.
I think Anjali can move over to the next way. I think we'll do the chat box, no? Then we'll correct it, and if necessary, then we'll send to the speaker the questions that people ask for. Then we'll.
Okay, sir, sure.
Yeah.
Okay, we'll go for the next speaker. This is Mr. Shekhar Prabhakar, CEO, Hasiru Dala Innovations, Bangalore. Shekhar Prabhakar is a co-founder at Hasiru Dala Innovations. It is a company that is focused on creating a better livelihood entrepreneurship opportunities for the waste pickers through inclusive waste management services that enables a circulatory economy. He has 22 years corporate experience in sales and marketing in the IT industry in India and US, and as a professor of marketing for 10 years. He is a graduate from IIT Madras and IIM Kolkata. Welcome to you, sir. Over to you, sir. Shekhar, sir.
Thank you, Anjani. And yes,
No.
Mr.
Just a second, because I see some hands rising here. Professor Thotar. I mean, do you have anything to say, Thotar, Professor?
Happy morning, sir, to all. I'm Vijay Kumar Thotar here. Can you hear me, sir?
Yeah, definitely, yes. I mean, is there anything you want to say?
Sure. Yeah. Actually, one logic question I'm asking. Nowadays, that e-mobility is gaining the importance all over the globe, actually, across the globe. But to have 1 unit of that electrical energy at the user end, we need to invest 22 units of chemical energy at the coal, or for example, I'm talking.
No.
Something
So let's amend. Do you have anything specific to the speaker?
Sorry.
I mean, otherwise
Because climate change and this impact of climate change, they are just quoting, I'm relating to that, actually.
No, fair enough. I think you can send the question, then we'll get back to you. Okay. Thank you very much, sir.
Yeah, definitely, sir. Thank you. Okay, thank you, sir.
You can go ahead, Shekhar Prabhakar, yes.
Thank you, Dr. Chashida, for a very enlightening talk. It's always difficult to follow on to such a well-detailed, well-thought talk. So anyway, my name, as I said, is Shekhar, and we work with waste pickers and therefore provide waste management services to the city of Bangalore and also in Aurangabad and so on. Anyway, today, as we talk about climate change, one of the things that contributes to climate change is irresponsible waste management, right? Plastic going into oceans, leachate going into groundwater. All of that is part of climate change that affects us on a daily basis. So of the many things that we have to do to both mitigate and adapt to climate change, waste management and responsible waste management at that is of great importance. Now, while waste management has a lot of behavioral changes that we require to do as individuals. For example, in Bangalore, we're supposed to segregate waste into 3 streams as per the law. Organic wet, inorganic dry, and rejects or domestic hazardous waste. Are all of us doing it? Because by that simple action, you will contribute tremendously to having waste managed properly, because organic waste can be composted or converted into biogas, right? Which can we replace liquefied petroleum gas, which is a fossil fuel. So there are things that we can do as individuals. There are things that we can do as companies. There are things we can do as government things. But it starts with us as individuals. And I'm just going to lay that on the table for all of you, that please segregate waste at source, right? It is absolutely the first 0 step, I would call it, that leads to good material recovery. Now, coming to the role of science and technology in waste, waste has become such a huge problem. In fact, I foresee that in the future, in fact, starting now, there are only 2 things that cities will really grapple with. One is mobility, traffic, transportation, and so on. The second is waste. Bangalore today has unfortunately come to be known as Garbage City from Garden City. And it is because the amount of waste that we generate as consumers, and as well as industries producing something, has increased. Today, we generate estimated 6,000 tons of municipal solid waste in Bangalore. right? And it's only going to increase. So what are the things that we need that science and, how can science and technology actually give support to people who are in the waste management industry or those who do waste management to recover more material and put it back as a resource rather than it going to the landfills or to the oceans or whatever, right? So my talk is going to talk about some of the things that are happening in the science and technology space that is helping this. So let's take organic waste. Today with organic waste, you can either compost it into high yielding organic manure, but that's a negative value process. That means you have to put more time, effort, and money, make it into compost than what you can earn a revenue from it. But something like biomethanation, which is anaerobic digestion of organic wet waste. All of us have seen in villages, maybe in our own homes, where we had cattle, cow dung biogas generators, right? Technology has improved a lot since then. We, for example, have just set up a 30-ton per day organic waste to compress biogas plant in Harohalli near Kanakpura. And this uses the latest technologies, both electromechanical as well as microbiology and chemistry to improve the yield of methane from such gases so that it can actually become a viable financial plant, right? Where the revenue from biogas and organic manure can actually pay for the processing of waste, right? So that actually what was waste becomes two products, and actually there's a third product, which is water as well. If you have a proper ETP system, you can actually give industrial grade water as well. So there are three products that are possible, and there's a fourth product, which is carbon dioxide, of liquefied carbon dioxide for making ice. So there are ways and means today of taking waste and creating into resources that can flow back into the economy, which is what is called a circular economy. So organic waste can therefore come back as organic compost to farmers, back into your food. Compressed biogas can be used in kitchens, replacing liquefied petroleum gas. Water, which otherwise would evaporate from wet waste, can be brought back into the water stream, and so on, right? So all of this is possible today because of the advancement of both science and technology in the organic waste space. Coming to the inorganic, all of us are talking about climate change, the impact of waste plastic on our oceans, on our landfills. Now they're talking of microplastics in our blood and so on, right? So today, India actually has some of the highest percentages of plastic recycling thanks to waste pickers and the informal waste economy in India. But a lot of it is mechanical recycling, which actually downcycles. For example, your water bottle, PET. That polymer is downcycled into polyester yarn, which goes into your t-shirts, which then again becomes end of life and goes to a landfill because nothing can be done with multi-fiber apparel in terms of recycling. So there are now, from the university labs to it's coming into commercialization, chemical recycling, right? Where actually you can break the polymers into monomers and then recombine them into polymers, right? You could also have pyrolysis techniques, where pyrolysis is the gasification of these plastics under vacuum conditions, and you can actually get light diesel oil from it, You can take your used vegetable cooking oil and make it into biodiesel, right? So the promise of science and promise of technology in handling our waste is immense. And thanks to a great awareness today amongst policymakers, all of you might have heard of COP26, which happened in Glasgow recently. Everyone is focused on how do we manage our waste, right? The best is, of course, not to create waste. I'll come to that in a bit. But how do we manage the waste that we do create and try to bring it back into the economy as a resource in a financially viable manner? And that financial viability will come from advances in science and technology, and not just processes or improvement in processes or productivity or better collection, so on. Right? Even at the sorting end, for example, today you have, when we collect dry waste from you, it has plastics, it has cardboard, it has metal. Dry waste can be sorted into 75 categories of waste that can then be recycled in some form. Now, you can use infrared technology and infrared camera technology to actually identify the different plastics and sort it using mechanical conveyor systems and air jet systems to sort it automatically. You have robotics, which can pick, instead of a person picking, which can pick the right polymer and put it into the right dustbin, into the right bin. You have today AI and machine learning concepts which are being implemented for characterization of your waste and sorting of it. So there is a lot of potential of the impact of science and technology in waste management. And people like us and the company are really looking forward to be able to adopt some of these and bring it to Bangalore or bring it to India so that we are able to do this. The other thing, as I said, is behavioral a lot. For example, can you think of buying a refill of something like we used to do in the olden days, where we used to take oil cans, and go to the shop and he would measure and put that amount of oil. Can we go back to such refill systems, but with better controls on quality and contamination, right? Can producers of products, brands and so on, redesign their products so that their products are repairable, refurbishable at the first instance, and even if they do create waste, can all the materials in that product be recycled? And also the use of recyclates in their products and packaging, right? For example, we are working with a large global apparel retailer where this whole season's clothes, all the buttons in their apparel will be made from recycled plastic. And so those are the ways in which science and technology has helped in trying to get waste to be converted into resources that can come back into the economy and mitigate things like climate change, make our cities cleaner, and therefore lead to better public health and so on. Right, I'm going to stop here at this point of time because I think I have also, it's 12:45. And I will wait for questions if anyone has to be able to answer. Thank you.
Thank you, sir. Any queries from audience?
Can I mention a word with Shekhar?
Yes.
Yeah. So, this is something which, we had discussed in various policy platform too. One of the major problem of waste segregation is, even if segregation is done locally, by the time it goes to a centralized waste management plant, things get mixed up because they go through 2-3 stages of movement transporting the waste. That's where it gets mixed of waste to wealth plants, for whatever the kind of waste management plants you have. So, I mean, I sort of thought, Gandhian way of dealing with this better, because decentralized waste management plants, somewhere the technology has to be that every ward or even at the sub-ward level, there can be waste management plant, which doesn't, the problem is because it's smell and other reasons, people want to tend to move the waste management plant to outskirts of the city, and all the waste of the entire city has to move every day to the outskirts. In the process, the segregated waste again gets mixed up. So we need to solve that problem too. This is where, civic society has to really, provide awareness to all the people. And that's another, it's a more of a social problem than technological problem.
Actually, Bangalore has adopted a decentralized waste management philosophy. For example, each ward has a dry waste collection center where waste is sorted before sending it out to the recycling supply chain. The challenge has always been with organic waste, where like you said, not in my backyard syndrome tends to play, which is, you go do it somewhere else, not next to my house, not next to my flat, and so on, right? For example, the law says that all apartment complexes, commercial establishments, corporate campuses should do in situ composting or in situ biomethanation. But no one wants to do it, right? They would rather have it out of their premises rather than compost in situ. So there are challenges, as you said, Dr. Chashida. The philosophy of people like us is decentralized waste management. Even the plan that we have set is a 30-ton per day, which is 0.05% of what we are generating every day. So it is not a huge plan. So, but we actually for 4 years tried with the BBMP to get land within a ward or within a panchayat to be able to do it. We couldn't. And finally, we went to a private industrial estate and set up the plant, taking a lot of risk at it. But yeah, so I do take your point, but there are challenges of civic society accepting it, of political will, and so on. So those are the challenges, rather than, as you said, the availability of technology or any other thing.
Thank you, sir. Very good information you have shared with us. Thank you for that. We'll go for the next speaker, that is Mr. Karthik B, Senior Project Engineer from CCD Society, Bengaluru. Over to you, sir. Karthik, sir.
Yeah, thank you, Anjani. And I thank everyone for inviting me to this Azadi Ka Amrit Mahotsav, and I thank again, the KSTC Council for this. And straight away, let me go into the presentation. Hope everyone can see my screen.
Yes, sir.
Yeah, thank you. So today I'll be presenting about the nature-based solution for wastewater management, where we CDD Society is one of the pioneers, I would say. Like, since we are working past since 2005, ideally I would say 2002, and we were registered in 2005, and we are sort of a network-based organization where we have about 22 consortium partners all across India. And our focus is mainly on decentralized nature-based solutions for the management of water and wastewater. We have one, I would say, I would call it a philosophy where we say that what cannot be maintained should not be built. See, the problem comes every time in maintenance. So where you have a lot of infrastructure that is being constructed, but later it becomes redundant because it's not maintained properly. So most of our sewage treatment plants in India are in that case. So if you look at our portfolio, a small, we work in wastewater treatment and reuse, fecal sludge management, where the focus is on managing the sludge from the septic tanks, because many of these smaller towns doesn't have underground drainage systems. We also work on a lot of water body rejuvenation projects, and to a small extent in solid waste management. We also have, for example, since this is a department, we are also recognized under Department of Scientific and Industrial Research, and also we have a center for advanced sanitation solutions, which has focused on capacity building. We have knowledge management, a very big sanitation exhibition. So if one comes to a sanitation exhibition, they will know, okay, what are the problems and challenges that India faces in sanitation and what are the solutions for it. And with respect to snapshot and the reach out or the impact that we have created, we have implemented almost over 430 plus water systems all across India, and are treating about 15 million liters of wastewater every day. And also we have worked on mostly 16 water body rejuvenation projects all across India, and also have trained 3,500 plus individuals, NGOs, governments, panchayats, and with 169 trainings that is being hosted. I would directly maybe go into the detailed main presentation, where if you look at the sources of wastewater. When you say wastewater, I wouldn't ideally call it wastewater. I would ideally call it used water. But the term wastewater is predominant across the entire sector. So if you see here, you have urine and you have the toilet flushing water. The urine plus toilet flushing is ideally called the yellow water, where with the feces and the urine, it's called brown water, and the yellow water and the brown water together, we call it black water. So this black water forms a component of the fecal sludge, which is which is ideally stored in septic tanks or pits, or in case of cities, it has been sent into it's been conveyed to sewage treatment plants via sewer networks. So you also have the kitchen and the bath and the laundry water, which ideally is called grey water. So the grey water, the black water together forms the domestic sewage. And in certain areas, for example, if you go to the like the old cities and in the old cities, where even the stormwater of the town is combined with the domestic sewage. For example, storm drains also carry sewage. So there it's called a combined sewage system. Let's understand, where our sort of wastewater goes. It goes into STPs. Like mostly it goes also into drains. It goes into water bodies, and also goes into septic tanks. When you say STPs, you have to sort of as I said before, it is sort of conveyed. For example, from a household, the toilets is conveyed into a C1 network, and from the C1 network, it goes into STPs, pumping stations. And in case where there are no C1 networks, ideally the grey water is being discharged into the open drains. For example, you could see in almost all the rural areas where the grey water, which is the kitchen and the bath water, is usually discharged into the drains outside your house. And finally, it reaches the water bodies or any other, forms a pool of land stagnant water on the land also. But if you see, the black water ideally is disposed into septic tanks and pits. And if you look at the septic tanks and pits, sometimes they are designed in such a way, at certain places it is designed with the line bottom, where the solids settle, and you have the overflow from the septic tank, which is called supernatant, and that is also discharged into drains. At many of the places, you have circular pits where it's open to the bottom. Under Swachh Bharat Abhiyan, like mostly twin pit systems were built, where the bottom is not being lined, and it's been allowed for the water. It's been allowed for the water to be soaked. But it's not a problem. The twin pit system is not a problem where you have deeper water tables. But it's a very major issue when the water table is high, where it can pollute your groundwater. So this is what actually we see. Because of all these problems, we see most of our 70% of our Indian urban sewage is being discharged into water bodies. So what the pictures that you could see, and also if you see the legacy waste or the waste, the solid waste is also being dumped into the edges of these rivers, lakes, water bodies, and mostly it's also polluting our groundwater resources. And if you look at also our STPs in India, I would say nearly 63% of all the installed STPs, they are functional. But what happens is that their performance is not that great. They have only until a secondary treatment, which removes, organic content. But when it comes to removing, nitrogen or phosphorus or like the nutrients, so they really don't perform, in a certain way. And already they're also overstressed. For example, if the treatment plant is designed for say about 35 mld, but ideally they'll be receiving more than say 35 mld, and ideally they'll be sometimes bypassing the system, bypassing the wastewater to a drain, or but sometimes the urban infrastructure is so overstressed, and we have a lot of in the rural areas very inadequate poor sanitation facilities, and especially in the slum areas as well as in the rural areas. So looking at even when it comes to the understanding the technical capacities of the government machinery, they do hire a lot of consultants, but the technical capacities of the government machinery is also limited, and awareness is also very less. But we have a solution for this where we have a system called DWATS. DWATS is called decentralized wastewater treatment system. It usually sort of uses we have also global recognition. It also doesn't use electricity. I'll come to these principles a little bit in the next slides. And it's also part of the CPHO manual, where it's a very simple sort of system. Let's play a video on how the system works.
Karthik, probably audio would have been better. Audio also would have been better. I mean,
So hope you have seen the video. This is a problem actually. Most of our STPs sort of have a lot of long-term issues, but the long-term issues is mainly sort of due to for example unavailable of electricity, or the pumps get failed, and it takes time for them to replace them, or budgets are not allocated for the operation and maintenance of the entire system. So there will be also budget issues. So to avoid, I would say, if what if the operation maintenance cost is very very low, so which means even a single household or even an apartment complex could can manage the system easily. There's a major problem. What happens here is, for example, you have big apartments in Bangalore. You have a rule or a law by law saying that every house, every apartment which has more than 50 households should have their own sewage treatment plants within their boundary or within their site. So, but what happens is when the apartment or the complex is being built, the majority of uh, uh, the uh, the majority of the majority of call it the approach is given to conventional technologies which use high electricity and high a lot of pumps. But the problem here is when the apartment is being transferred to the housing association. So the problem comes, how do they maintain it? How do they find funds to the maintenance plan? So ideally, over the night or in the early mornings, without treatment, they let the wastewater into the drains, which again finally ends up in water bodies or open lands. So this is a major problem. So we have a simple solution which is decentralized or DWAS. So here you have a sort of a channelized water from an household or from an apartment which passes through a sort of screen and a small grid chamber. So ideally you don't need a screen and grid chamber, because once you install a screen, so people why I'm telling that we don't need a screen is because the I will design the primary treatment system, the settler, or to handle the solid waste. Because once you install you install a screen, you need to have a daily operation maintenance. Someone has to come, someone has to clean it. But what if someone doesn't come and clean the screens? So looking at low operation and maintenance, so we have to sort of think of whether to implement screens or not. So, but ideally, in our recent projects, we have been implementing screens. We are ensuring that particular operations activity of screen, removing solid waste from screens is being done at least once in say about 3 days or 4 days. Or else, what happens is if someone doesn't come and clean, there'll be a backflow of water, and that water would come into your house. So there'll be backflow issues. And if you see, look at the second part of the third stage, which is the primary treatment, which is a settler and a balancing tank, I would call it. So usually settler is mainly for settling all the larger particles. You might have heard of this in Hoff cone, where if you leave the wastewater to for 45 minutes, so almost all the settleable particles will settle down, and you have the float, which is the oil grease layer, the scum layer will be floating on top of it. So nearly about 15 to 20% of the treatment, I would say, will happen in the settler, and it goes into a next treatment where the overflow of from the settler goes for a secondary treatment, which goes through a baffled reactor. So you can see we allow the water to pass through an upflow movement where you have suspended growth process, where the microbes which are freely moving in the water will try to eat or digest the organic matter, the carbon, and the water which comes out of anaerobic baffled reactor removes about 60 to 70% of the biological oxygen demand, or the BOD. And the next part of the secondary treatment is anaerobic filters. Again, you have sort of an upflow movement, but with a filter media in between. So the filter media is usually cinder or corrugated pipes. So the media, so which has more surface area. So we can ditch forms, over the filter media, a biofilm has been formed, and that sort of, your microbes sit on those biofilm layer and starts, digesting the organic matter. So the outlet of the secondary treatment, if you could see, it would be around about 80 to 85% of BOD removal. And if you see the primary and the secondary treatment is completely an underground based treatment, which means the top slab can be used for once the treatment plant is constructed, the top slab can be used for other purposes. And it's also anaerobic system. So when I say anaerobic system, it does mean that you're treating the wastewater without oxygen. And the wastewater which comes out of the secondary treatment will be having some slight of color and smell. So, and the BOD would be in the range of about 30 to say about 40 milligram per liter. But the outflow to remove that further, the smell as well as the color. So we have a horizontal PGF. A PGF is a planted gravel filter, or we call it a constructed wetland. So which aerobically sort of treats water. So it's a subsurface wetland based system, so which treats the water, which removes the color, which also provides oxygen to the water through these these root systems, and the BOD will come down say to anywhere between 15 to 20 milligram per liter. So this is a concept that we try to implement in most of our projects, especially when we call sort of DWATs. But why, when I say DWATs, why DWATs? So you can treat up to say about 1 to 1 mld per day, and it can absorb a lot of shock loading. When I say shock loading, say today you have designed a treatment system for say about 10 KLD or a 100 KLD system, but saying say that particular day you have someone in your house and the system you have this wastewater generation is about 115 KLD or 130 KLD. There is a buffer. There's a 20% buffer that is being allowed when we are designing the system, and the system is also very modular and expandable. So you have a place for a primary treatment system somewhere undergrounds, and you can also sort of customizable as per the local site conditions, and it's also modular and expandable. And if you see, it's also compliant to the effluent discharge standards, and also the byproducts. For example, the sludge that you take out as well as the water that comes out can be also used for irrigation purposes in your gardens, can be used also for agriculture, and with one level of extra treatment with sand and carbon filter can also be used for flushing. Flushing, for example, if you have a dual piping system in your house, and can be constructed with local resources, and also it's a very sort of a simple civil structure that that has been built with some if you teach a mason how to build it, I think he can again take it to other projects also. So it is that simple also to construct it. The major is very low. It requires very either if there is a gravity, it's completely a gravity based system, so ideally it doesn't require electricity. But in case of a flat land, and if there are some issues of bringing the gravity flow, so we use a minimum electricity of just a single pump, a single 1 HP pump, and we don't add any sort of chemicals or external additives. And even for maintaining this plant, you don't need a skilled manpower. So you, for example, in an apartment, the watchman or the security guard also can easily maintain this plant. And sludge, for example, if you go to conventional STPs, so you have sludge generation every day. But in this sort of a system, you have sludge generation only a minimum for about only once in a year or once in 2 years. You remove the sludge from that septic tank, and as well as all the modules. And this could be sent for drying, or can be used as soil conditioner in agricultural lands. And you also have the constructed wetland, where I call PGF, very similar to gardening. Like for example, once there is an uptake capacity of nutrients, so the nutrients are usually stored on the leaves and the stem. So ideally, it's very similar to gardening. You just need to cut the stems and cut the branches, and then the plant will start growing again. So this is why the DWAT is sort of implemented. And we have implemented this DWAT system at I said like 430 plus DWAT systems. Tarun Hospital. If you go to Bangalore, we have this BBHC apartments. We have IIT Gandhinagar in Gujarat, a 600 KLD system, and a 1 MLD system for Mahadevpura Lake. So in Mahadevpura Lake, what we have done is we have taken there's an open channel flow where the wastewater goes into the lake without treatment. So we did just polluting the lake, and ideally what the BBMP did is they constructed a bypass drain, so which diverts all the wastewater. Eventually, it was also diverting the monsoon water. So so monsoon water where the lake remained dry. So what did we do is we did also redesign the entire diversion system so that the monsoon water also flows into the lake, and also we diverted 1 MLD of 1 MLD, 1 million liters of wastewater, and treated is using a DWAT system, and then we let back into the lake. Today, if you see, if you go to Mahadevpura Lake, which is close to Bagmani Tech Park, you could see the treatment system, and it's been functioning for the past 3 years without any issues. So this is one of our achievements, I would say. And we have also built a DWAT-based system for a Suvidha complex, which is funded by Hindustan Renewable Limited. So where we use DWATs for primary and secondary treatment systems, and also coupled, for example, here this has been implemented. It's a public toilet with you have it's a showcase sort of a model where you have a public toilet, you have a washing machine facility, and we have also a very small area. So the problem was, here, we had to show a model where, we can integrate also in hybrid. For example, if you want to reuse the water for flushing, then I said that, you have to couple it with, some advanced treatment process, for example, with sand and carbon filters, with fluoride bed reactor, with a simple hybridization. We try to work it out, and we have implemented this in Mumbai, in Maharashtra. So this is one of our sort of a hybrid DWATs project where I said from complete nature-based, like, it's partially nature-based, sort of a hybrid system. So this is mainly to look at, for example, in cities, we have the space, for example, the land availability, the space is very, very, very less. So we have shown, as a very a successful project here. And we have also implemented this in a tsunami rehabilitation colony. For example, when in 2004, when tsunami happened. So after that, this is a project in Nagapattinam district in Tamil Nadu, where we sort of implemented a simplified sewer system, conveying it to a DWAT system. So where the wastewater and the sanitary is being treated. And as I said before, in Mahadevpura also we have implemented the system, and play small video.
Excuse me, sir. Excuse me, Karthik, sir. Excuse me, sir. Karthik, sir.
Yeah.
Is it possible to conclude in another 5 minutes?
Yes. In 2 minutes, I'll have a last slide. That's all.
Okay.
Yeah. So this is a lake that we did, and also we are working on a same developed DWAT system in Talodi municipality in Maharashtra, where we have proposed a 500 KLD sort of a system with also the FSM as well as solid waste management part. Thank you.
Thank you, Karthik, sir. It is a very nice information you have shared with us. Now, I would like to call Mrs. Priyanka, Project Associate, to deliver a vote of thanks. Thank you. And certificate link will be given in the chat box. All the participants are requested to fill the certificate link, which is available in the chat box.
Anjali, where is Priyanka?
There is audio issue in our system, sir. She'll come.
I think let her come to your system and before that, I think Karthik, it's a wonderful presentation. I think we need to collaborate also as well. See,
Sure.
work on rainwater harvesting, roof water harvesting. I think probably the final thing is, I think it has to be integrated also.
Yes, sir. And one more question has been asked. Actually, Priyanka asked a question that please throw some light on the cost. Meanwhile, if you look at the 1 MLD sort of a system, when it comes to the capital cost are a little bit higher because it's the entire like a civil structure. If you want to treat about a 40 or 50 KLD system, it will cost you 30 lakhs. 30 lakhs. But if you go for a conventional, the capital cost are about 15 to 20 lakhs. So the cost is about 20 to 30% higher. But when it comes to the operation cost, so hardly it's about 1 to 2 lakhs a year. So if you look at a 1 MLD system, it's about 6 lakhs a year. So 6 lakhs a year comes to about 40 to 50,000 a month. So for it, if you go for conventional systems like SBR or a sequential batch reactor or ASP sort of technologies, per month it's about 2.5 to 3 lakhs. The operation cost alone.
No, apart from that, Bangalore Urban ZP has asked for the rejuvenation of about roughly close to 100 plus lakes.
Yes, sir. Yes, sir.
Were you there? I think when now the MPRI has taken up preparing the RFP, no?
Yes, sir.
Were you there, part of that, any lake in Bangalore Urban ZP, because they're going for a big way now? So they have some, Were you part of that? No.
I am not sure, so maybe I have to ask because I have been replaced with Rohini for this presentation. So I think Rohini might have the information. I'll get back to you on this.
Okay. Because we met some of the, some of your colleagues, I believe. I met doing that work. Yeah.
Yes, sir. Yeah.
Okay. Right. Thanks.
Thank you, sir. Thank you.
Yeah, okay. So myself, Priyanka. So I had some issue with my mic in my system. So sorry for that inconvenience. So it gives me an immense pleasure to deliver a vote of thanks on this occasion. So first I would like to thank all the participants and the eminent speakers over here who had made this program very successful. So as all you are aware, the series was of 8th month and we have successfully completed 8th month on the occasion of Azadi Ka Amrit Mahotsav, that's Vigyan Utsav. Firstly, I like to thank our Executive Secretary, Mr. H. Iman Kumar, for supporting in successful of this program. And I would also extend my thanks for Professor Mantomani for giving vast information about green energies, alternative building technologies, and also giving information about climate change and its impact. Thank you, sir. And I also thank Professor L.S. Chashida for giving a enriched knowledge about how to utilize the technology in a very best manner that enriches society. Thank you, sir, for your vast information. I also thank Dr. Yes Prithvish, sir, for taking us through a journey in a medical science from the pre-independence to the post-independence era with the many inspirational thoughts. Thank you, sir. And I also extend my thanks to Mr. Shekhar Prabhakar from Hasiridala Inventions for giving us a importance of managing waste in the society, especially in the Bangalore. And I also thank the last speaker of this webinar, Mr. Karthik, Senior Project Engineer from CCD, for giving us a very local based solution in managing wastewater and also importance of rejuvenation. Thank you, sir. So with this, I extend a warm thanks for all the speakers and the participants on behalf of Karnataka State Council for Science and Technology. Thank you. The next theme will be communicated through the email. So thank you. So we expect the same participation for the next series, next webinar as well. The link for the certificate has been posted in the chat box. Kindly fill your details in the feedback form so that certificate will be issued within a week. So thank you all.
Hello. Now it's audible.